More than 17 million Americans have a serious problem with alcohol, but only a fraction of that number ever seek help for it.
Craig Lamb, clinical director of Gateway Foundation, sat down with Tanya to explain some of the signs that someone might have a problem with their drinking.
Certainly there could be a couple things to look for. One would be if somebody's mentioned drinking as a problem, any dramatic changes in behavior or mood. Could be consequences, medical consequences or physical consequences at work due to drinking.
Yeah, but sadly, the person that's experiencing this problem doesn't always recognize that.
They probably would not be the first to know, right? It's typically coworkers or a family member or loved one that would first notice there might be an issue with the drinking.
And just so that people understand, how big of a problem is alcohol and people not being able to control their use of it?
So 17 million Americans suffer from problem drinking. To put it in perspective, alcohol kills more people than the opiate crisis. Not to minimize the opiate crisis, but just to kind of give it some perspective.
And that being through what, car accidents or the medical consequences?
Medical consequences. I mean, even withdrawal from alcohol for a problem drinker could be deadly.
How so?
Unmanaged, you could see seizures, delirium tremens. Coming off of alcohol can be pretty intense and does typically require medical intervention.
Yeah. And so someone who cares about someone who is experiencing this problem, they may have a hard time having that conversation with someone. How do they approach that?
I mean, I think it would depend on if it's an employer or a loved one. I think suggesting that there's help, I would want to do our part in destigmatizing that. For some reason, alcohol is seen as, I think, still this old school way of stigmatized, or it's a moral failing. It's not. It's a medical condition. I would want people to know that it's okay to talk about, that it's okay to approach someone and say there is help, there's medical interventions to help with their alcohol problem. If someone has diabetes or a broken arm, they go to a doctor.
Sure, to get treatment.
Right. With alcohol, somehow, oh, I need to keep this a secret. No, it shouldn't be. I would like to undo some of that and know that it's a medical chronic condition that is able to be treated effectively.
Now, there's a difference, too, people need to understand between having an alcohol problem and binge drinking.
Sure.
Tell us about the difference between the two.
So binge drinking is typically, for women, 4 drinks in a row. In a 2-week time period. For men, 5 drinks in a row. That would be considered binge drinking. And then there's daily drinking would be, substance or alcohol use disorder severe. So yeah, I think a lot of people might be binge drinkers and not know it.
True. They just think they're just having a good time with their friends.
I'm just having a good time with my friends.
Or celebrating.
I'm just hanging out. Yeah.
Yeah, and there's really something to be considerate there. And what are the dangers? We talked about some of the medical issues, but what are some of the other dangers that come along with the alcohol abuse?
So there's certainly liver disease if you're a long-term
cirrhosis.
Right, chronic drinker. The withdrawal we talked about can be
yeah, a lot of people don't really consider that.
Right, and I'm not talking about just a hangover. I'm talking about there's going to be vomiting, could be seizures. If I'm someone that's drinking daily and I just try to quit.
And this is something that Gateway can obviously help with.
Oh, certainly. Yeah, Gateway offers a lot of medical interventions along with the counseling and therapy.
And is the therapy and the counseling, does that also involve your loved ones as well? Or is this strictly just for the person who may have the issue? Typically
with Gateway, we're going to focus on the individual in the short term for stabilization, but certainly we do couples and family therapy as well, especially in our residential settings.
And so how does someone approach this situation? Is it as simple as a phone call, or do they need to come into you guys? How does this all work?
I would say probably easiest access is the Gateway hotline. We have a 24/7 hotline where you can talk to someone. They're going to ask you some basic questions to determine the severity of the issue. And there's multiple forms of treatment. So some people may only need an outpatient level of care. So I'm going to go to work and then at night I go to my groups or my therapy sessions. Some people require a little more, maybe a residential stay for 3 to 5 weeks.
But you never know until you actually make that first step.
Right, and talk to someone and find out, what are the options available, how severe is it, what's going to best help me.
All right, if you or someone you know is struggling with addiction, you can reach out to Gateway Foundation, the number right there on your screen.